Every 5 seconds, someone on Earth is newly diagnosed with diabetes. But what if one small pill, taken just once a week, could change that? This is trelogliptin, a drug some call the once-weekly miracle for type 2 diabetes. But is it really as powerful as it sounds? Today, we break down the real science, exactly how trelogliptin controls blood sugar, and whether the evidence backs up the hype. Welcome back to Diabetes 2 Reversal, where we turn complicated medical science into clear, honest, evidence-based answers. In type 2 diabetes, the body can't use insulin properly, so sugar builds up in the blood instead of fueling the cells that need it. Meet trelogliptin, also known as SYR472, or by its brand name Zafetec, a medicine from a drug class called DPP-4 inhibitors. Normally, an enzyme called DPP-4 quickly breaks down two hormones, GLP-1 and GIP, that help control blood sugar after meals.
Trelogliptin fits directly into that enzyme's active site, blocking DPP-4 so it can no longer destroy those helpful hormones.
With GLP-1 and GIP protected, the pancreas releases more insulin, but only when blood sugar is actually rising after a meal. At the same time, trelogliptin lowers glucagon activity, so the liver releases less stored sugar into the bloodstream.
It also slightly slows stomach emptying, letting sugar enter the bloodstream more gradually instead of causing a sudden spike.
This directly improves insulin sensitivity, tackling insulin resistance, the deeper root problem behind most type 2 diabetes cases. In a landmark 2016 study in PLALAS 1, Dr. Charles Grimshaw's team showed trelogliptin binds DPP-4 far more tightly than older drugs. That research found trelogliptin roughly 4 times more potent than alogliptin, and about 12 times stronger than sitagliptin.
Unlike most diabetes pills taken every single day, trelogliptin is dosed just once a week, but a real convenience breakthrough.
Its slow, lingering grip on the DPP-4 enzyme is what allows one dose to keep working steadily for an entire week.
Clinical trials conducted in Japan showed trelogliptin meaningfully lowered HbA1c, PET, the key long-term marker of blood sugar control.
Because it only boosts insulin when sugar is high, trelogliptin carries a comparatively low risk of dangerous hypoglycemia.
Studies also report trelogliptin is largely weight neutral, unlike some older diabetes medications that tend to cause weight gain. Reported side effects include mild headache and cold-like symptoms, and rarely, pancreatitis occurs, so medical supervision is important. Here's the catch. Trelogliptin is currently approved only in Japan and South Korea. Not in the US, UK, or most of the world.
So how reliable is the science? For short to medium-term blood sugar control, the peer-reviewed evidence is genuinely solid, but long-term heart health outcome data, common for older DPP-4 drugs, is still limited specifically for trelogliptin.
Trelogliptin is not a cure. Real, lasting diabetes reversal still depends on diet, exercise, weight management, and consistent medical care.
Trelogliptin is designed specifically. It is not appropriate for type 1 diabetes or diabetic emergencies. It also isn't recommended during pregnancy or in certain kidney conditions without close specialist supervision and dose adjustment. In the real world, once-weekly dosing often means better adherence. Patients simply forget to take daily pills far more often. Because it's not globally approved yet, access and cost outside Japan and Korea remain real practical limitations for most patients. The verdict? Trelogliptin is a scientifically sound, well-mechanized treatment. Promising, but still regionally limited and not miraculous. To recap, trelogliptin blocks DPP-4, protects GLP-1 and GIP, boosts insulin, lowers glucagon, all from one weekly pill. If this helped you understand diabetes medicine a little better, subscribe to Diabetes 2 Reversal. We break down real science every week. Thanks for watching. Stay informed, stay healthy, and we'll see you in the next episode of Diabetes 2 Reversal.